Into your Superstation Joy 99.7 FM. I hope that you're having a wonderful week so far, and I'm looking forward to an even better few days coming up. So, as you're aware, it's October, and October is Breast Cancer Awareness Month. And so tonight we're going to be having a conversation on breast cancer. Tonight we want to talk about the myths and the facts about breast cancer. Sometimes we hear stories that are so ridiculous, and then sometimes you hear things that sound ridiculous but are actually true. So we really just want to answer your questions and, bring some awareness and, of course, remind you to get checked as well. So that's what we're doing tonight. It'd be great if you have questions. You can send them in. Our WhatsApp line is open. It's 055-1111-997, 055-1111-997. We're also live on Facebook, so you can ask your questions underneath that video as well. So joining me tonight is Dr. Josephine Nsaful, who is the president of the Breast Society of Ghana. She's also general surgeon at the breast surgery unit of the Kolebu Teaching Hospital. Hello, Doc.
Hi, Animwaa.
Thank you so much for being here tonight. Yeah.
Thank you for having me.
So, another year, another awareness month. Mm-hmm. Are you seeing any improvements in terms of the awareness campaign? Are people showing up, more readily? Are they showing up earlier? Are they showing up less afraid?
I think so. Certainly not 100%.
Okay.
But, look at a few years back to now. Yes, we are having some people showing up earlier. Some walking in, I want to get checked, and then incidentally you find some things, yeah. So now we actually do diagnose smaller tumors. But we are still at the same time diagnosing, these huge advanced tumors. So it's a mix of both, but relatively getting a little better.
I mean, so what's and this is something I've always wondered. What goes on in the psyche of a woman whose breasts have started to change and they're able to stay at home and watch a whole, I don't know, like change and growth and things and still be home. When they come to you like that, I mean, obviously you're a professional, so I mean you have to be, but what goes through their minds and how do you even respond to that?
Yeah, I mean, there are different types. Those who are ignorant who just say, oh, enyamia, so it's nothing, but I heard on the radio, so I'm coming to check.
Okay.
Some of them, they're genuinely surprised when you tell them it's breast cancer. They say, oh, no. They're genuinely surprised because, but it wasn't hurting.
Okay.
Some of them are genuinely surprised. Or they'll tell you that, well, but nobody in my family's got cancer, so,
okay.
It's not right. Some are genuinely surprised. Some of them, I think they suspected.
Okay.
But they were really scared.
Okay.
Like an ostrich, you put your head in the sand, hoping to go away. So for some, they come very anxious. It's like they know, but they don't want to
accept or face.
Exactly. And then some don't want to actually pronounce the word cancer.
Okay.
Somebody comes for a second consultation. And so last week when you came, and the doctor opened the envelope, what did they say you have? So they said there's something in my breast. And I said, what exactly? Oh, Muse, BP, something. Like you can see, they are just trying to avoid having to pronounce the word cancer. So there's fear, there's denial, there is some ignorance genuinely, all sorts of reasons why people will dilly-dally. And then there are those who think that it's just plain spiritual.
Yeah, I was going to come to that, yeah.
It's spiritual, so then what do you come into a hospital for?
So there's, even with all the awareness that's being done, there's still people who come and they feel like, I mean, when they say it's spiritual, how are they presenting? Are they saying, like, oh, it's a spiritual attack,
yep,
or BIMEBB, or...
Exactly that.
Right.
Or some of them may have a story.
Okay.
About, they had a quarrel with a neighbor and then I dreamt that she bit my breast.
Okay.
Or somebody said when she saw the thing in the breast, then they went to some herbal person or they went to a prayer. So this person said it was the grand auntie, and then that person said it was a grandmother. So every stop, somebody is able to identify
Who?
an ancestor who is responsible for it. So it gets in their head.
Right.
You know, so they try everything and then they come when it's a bit too late.
A bit too late.
Yeah, but you know, anymore, I've realized that it doesn't really have anything to do with education.
Okay.
Because we see it in very educated people as well. So it's more about how we think as a people, how superstitious we are, or how religious we are, or how easily we are set in our ways, or how easily we even get brainwashed by others. Because you are going to see PhD holders, you're going to see the whole range. Yes, you will see some paupers, but likewise you see very learned people. You know, that's how we've been brought up.
Right. Coming with the same spiritual. Wow. It's very interesting. I mean, we know that, yes, we're a deeply spiritual nation, you know, but I think at some point when something is not working, why is the doctor almost always like the last resource? It's not even with breast cancer, but just generally, do you find that people are generally reluctant to go to the hospital?
Yeah. And it's not only breast cancer, and it's not only cancer, even non-cancer diseases. You know, I've had let's say somebody who's had a perforated stomach ulcer, and they are really sick and they need an emergency surgery, as in need the surgery now. A few people will tell you that the knife is not supposed to touch me, so they want to leave. We'll talk to them, blah blah, everything. They'll write a letter, discharge against medical advice, and then they go.
And then they'll go.
Yeah, and it's their right. So
then you have to let them go. So we got a note from a lady who said that she. It's 7:00, so I have to think about how to word but she had a meeting with a member of the opposite sex who had a cold and a cough and some sort of flu, things. And he focused his attention on her breasts for a period of time. She realized not long after that it started to itch and to feel funny, and so she was worried and wondering, could it be cancer?
Oh no.
Is that possible? Is that
not even close. Yeah, so it's not something you can pick up from someone. It's not contagious.
Okay.
Even when it's advanced and it's a big sore and all that, it's still not contagious.
Okay.
So it starts within the cell of your body, and it's not contagious. So that's
and you can't get it from obviously that's what contagious means. You can't get it from someone, or you can't. So it doesn't matter. It's not about what something does to you, what someone does to you, or what kind of contact you have. It's something that comes
from within a cell or the DNA in your body. So no, I have had a few boyfriends or partners ask me, and then big relief. They said, doctor, please, can I get it? They can relax about it. So they should. The men shouldn't run away. You won't catch it. So hang around, stick around, and support us.
And then the women also, you won't get it from any sort of physical manipulation
contact,
or. I'm really suffering with the words.
Pick and choose. Yeah.
So have we made any advances in discovering the cause?
The cause, no. As of now, we still know that it's a change or something wrong that is triggered in the DNA of the cell. Why it started, that bit we haven't gotten.
You still.
We have some risk factors in mind that increase your chance. So you may have the risk factor and never get breast cancer. And you may not have a single risk factor and you get it. So certainly we haven't understood the cause yet, And then the genetic ones are actually in the minority.
Okay.
Yeah. So
when you say genetic ones, what does that mean?
The hereditary ones.
Okay.
So there's a hereditary, I should have used that word. So the type that you can pass on. So one woman has it, and then she gives the gene to her
daughter.
Yeah, to her daughter, or even to her son.
Or her son.
Yeah. So there's the gene you mentioned earlier on. That's the BRCA gene. There are two of those genes, BRCA1 and BRCA2. Everybody has that gene, and the gene does what it's supposed to do. You'll be fine.
Okay.
So it's actually a tumor suppressor gene.
Okay.
So it's supposed to prevent you from getting some accidents in your cell
Okay.
that will make you get cancer.
Okay.
So if you have a mutation of that gene is faulty, then you can't suppress
the tumor.
certain,
So, but does it then make it more likely that, as opposed to oppressing, it will actually...
Yeah. So it increases your chance
the
of getting
likelihood. Okay.
certain cancers. So actually, it's not just breast cancer. It just so happens that with that mutation, your chance of getting breast cancer is very high, at least 80 or even 90%.
Okay.
Yeah, so almost definitely going to get it. But there are some other cancers that same gene is responsible for.
Okay.
Yeah.
Okay.
So, for instance, ovarian cancer, the fallopian tubes,
Okay.
prostate cancer,
Okay.
pancreatic cancer, a couple of others.
Okay.
So if you have that gene, you could get any of these cancers.
Okay.
It's just that
if you have a mutation of that gene, because you said we all have that gene. Okay.
Mutation of that gene, sorry, you could get any of these cancers. It's just that breast cancer is more common.
Okay.
Than, say, pancreatic cancer.
Yeah. Okay.
So then, if you were taking the family history, you would want to have a look at. You wouldn't ask just anybody in your family had breast cancer. Has anybody had any type
of cancer?
So it might have shown up in grandpa as pancreatic.
Okay.
Might have shown up as ovarian in mom, and then
it shows up as breast cancer
in maybe in two sisters. So knowing generally the history of cancers within the family could be a clue. And let's say you went and tested and you didn't have the BRCA gene. You still don't know whether you get breast cancer or not. Because there are other genes, less common genes, other genes which also can cause you to get breast cancer, other genetic mutations which can cause you to get breast cancer. So it's helpful if you knew you didn't have the gene, but it's still not. But
it doesn't really mean anything in terms of whether you'll get it or not.
Yeah, so I wouldn't say it doesn't mean anything. It's significant that you don't have it because it's commonly causes it.
Okay.
But it's not a guarantee.
A guarantee.
Yeah. So maybe you'll be a little bit more hopeful than say you didn't have it. So it's good to know if it's in your family. But there's no need for everybody just to go and test.
Unless there are indications.
Yeah. Exactly. So you should have some family history.
Okay. I'm trying to use the medical term. Is it prevalence? It will depend on what I'm trying to say. Is it that breast cancer is becoming, there are more cases of breast cancer now? Or is it that because of media and social media and stuff, there's more awareness?
Probably a bit of both.
Okay.
Probably a bit of both. Definitely the number of cases is going up.
Okay.
And we're not sure what we are doing. Is it our lifestyle? Very likely.
Okay.
I mean, we didn't have this number of cases. If you ask our grandparents, they didn't have this number of cases back in the day. Having said that, back in the day, is it possible you could have had breast cancer and never brought to the city for treatment, and nobody would know?
Nobody would know.
Nowadays, with all the noise we are doing, sometimes you get a call from somebody who is in the village. They want to bring the person down. So because of awareness, indeed, our attention is being drawn to it. But definitely, the number of cases is going up.
It's going up.
Yeah, definitely.
And we can't particularly tell why.
We can't. But it looks like a lifestyle thing.
It's a lifestyle.
Yeah. Maybe we should all go back to living in the village.
But there's also the food. I mean, right now we know that some foods have been termed carcinogenic, and some, if I'm using again the right word, and some things that we use around the house and all of that. The question is, I mean, if these things have been known to increase the likelihood or increase the whatever that then makes people get cancer, why do we still have those things? I think some of the things are like processed meat, some kind of processed meat, why do we allow those things if we know that they are actually potential cancer causing?
Yeah. So some of these things is also about the quantity you take, how
Okay.
much of it you take.
Okay.
So nobody says don't eat meat, but you really, really want to everything in moderation, really.
Okay.
And you should know about the healthy diet. Number one, fruits and vegetables, because they contain
Oxidant.
anti toxins,
Okay, antioxidants.
Antioxidants.
Yeah.
Yes.
Yeah.
And that's because they fight against the carcinogens.
Okay.
We don't know what we are even exposed to. So more fruits and vegetables, antioxidants, and it's helpful to reduce your risk. Not 100% prevent, but realize that those who really have taken a lot of fruits and vegetables have a lower chance of getting it.
Okay.
Why do we have processed meats? Well, I guess it is. So you just have to discipline yourself and take less. Then you should know which proteins are more healthy.
Okay.
So you go for the white meat, chicken without the skin, and then more fish, and every now and then certainly you can still eat your meat.
Your meat, yeah.
So I guess we all just have to be aware.
But all of these may lower your chance of getting cancer or breast cancer, but it doesn't. There's no like fail safe.
There isn't.
Which is kind of scary, because then you could do everything right and still.
There isn't. So we just have to do our best. Breastfeed as long as we can. Watch our weight, especially
breastfeeding.
So
breastfeeding is good.
Oh yes.
Okay.
Yeah, and it has to do with the hormonal changes.
Okay.
Our bodies are exposed to the cycle of estrogens and things every month when we menstruate. So if you've been menstruating for decades, you could do with a break. Yeah. So you see, when you are pregnant, you don't menstruate.
Yes.
Which is good. And
then
then you continue with breastfeeding, you don't menstruate. And if you're able to breastfeed on demand properly, every few hours you breastfeed, you don't menstruate. So it's actually been shown that if you can breastfeed your baby for up to 2 years, it lowers your risk of getting breast cancer.
Oh, okay. Okay, that's good to know.
Yeah, so I guess with that, the more babies and the more breastfeeding you do. So it has to do with the hormonal changes from breastfeeding.
Okay.
So before somebody calls in to ask, what about men breastfeeding? So I'm just going to clear the air on that. So obviously, that breastfeeding is not going to cause
hormonal
because it's the secretion of breast milk is controlled by the hormone prolactin, which goes up, and then the estrogen goes down, and that doesn't happen when a man is
breastfeeding.
Exactly.
So is there no way to simulate that in the body, maybe every few years, just to kind of, I'm sure every woman would be happy to take a break from her period. So is there no way to do that, unless, of course, I think there are some birth control methods that kind of mess with the cycle, but
yeah, they will change the hormone levels, like oral contraceptive pills, like the combined ones, the old time secure and the like. They have estrogens in it, so though you stop menstruating, they're actually exposing you to extra estrogens, and you don't need that if you have an increased risk of getting breast cancer. You don't want to be
so as
at
now, there really is no way that we're simulating that. Is that a thing that maybe we would be interested in doing one day?
It sounds like a good idea, but so far I haven't come across any research or anything on that.
Oh no, yeah. Okay. So a couple of questions. Somebody asked, does a dirty bra cause breast cancer? I think I've had this question like year on year. Can a dirty bra cause breast cancer? Some women don't like to wash their black bras.
Yeah. So braziers in any shape, size, form, color cannot give you cancer. Once again, it starts from within a single cell. So there's nothing you can put on it, sleeping with it, not washing it, which color is it? The black one,
The brown, the
the
red,
tight ones, the not tight ones.
Okay.
Wearing the bra, not wearing the bra.
To sleep, to not,
Yeah, anything around the bra, nope.
Okay. Okay. So it's, I mean, Doc has said that it's not caused by external, but wash your bras though.
Yeah.
I mean, like,
there's no excuse.
I know, right? This one says, can a lady under 20 years get breast cancer?
So it's very rare. It's very rare. Usually, children don't get breast cancer. I must say the youngest patient I have had was 18.
Okay.
And she came in, was really advanced, so she's no more. But I think probably she's the only 18-year-old I've had. If you search the literature, maybe there was somebody who was 16. But below 20, it's very rare.
Okay.
It's very rare. The commonest age group in Ghana is women in their 40s.
Oh, okay.
But we still have a good number of women in their 30s and quite a few also in their 20s.
What is it about women in their 40s?
I think there might be some race thing in it, because when you look at Caucasians,
Okay.
rather theirs is in their 50s to 60.
Okay.
So the peak age in the Caucasians is about 60, and the peak age in Ghanaian women is around 50.
Okay.
So for some reason, it's known that black women seem to get it at a younger age than the white women.
Okay.
Even if you look at black Americans, even they're all living in America,
but
the black
still,
race seems to get it about a decade younger. And talking about those who might get it younger is, we just talked about the BRCA gene. The thing about the BRCA gene is those who have the gene also tend to get it younger.
Okay.
And then those who have the gene, a lot of them too tend to get the more aggressive type.
Okay.
That's the triple negative type of breast cancer. That's also seemed to be associated with the BRCA gene.
Okay.
And incidentally, it seems that the proportion of black women who have this aggressive type, triple negative, is more than that in the Caucasian.
Okay.
So it looks like world over, when you look at the trends, there's something related to race.
Yeah.
Certain races may have more breast cancer, and certain races will have more of the aggressive breast cancer.
Okay.
Yeah, so there seems to be a lot of differences, in breast cancer. So the thing about breast cancer in Ghana is, apart from the fact that we are not diagnosing it early and we are coming with the advanced breast cancers, also the age seems to be younger. And then the subtypes seem to be a bit more aggressive. So those are some of the unfavorable characteristics of breast cancer in Ghana.
Yeah. Even though, again, it doesn't seem like it's easy to explain why.
Yeah, so it looks like there's something to do with race.
But it's interesting, and maybe this is a little bit not off topic, but with all the advancements in research and technology, and why does there seem to be this gap of knowledge when it comes to, I think, cancer especially?
Well,
do you buy into the, all of these theories about pharmaceutical companies and, what are your thoughts?
Well, I don't buy into those theories that they are trying to make money. So because of that, somehow
they're not going into the research proper.
Yeah, but when you bring up research, the thing is, the research obviously has been done in advanced countries. And then when you look at the pool of patients, most of them
are white.
Yes. So even the results that we are getting from this is more tailored towards the white people. And just now we're saying that we are realizing that cancers in black women are a little bit different. So could it be that, applying the research blanket across?
Yeah.
So really what we need to do is to do more research in black people.
Ourselves.
We need more clinical trials. Clinical trials is the hardcore research where you are looking at this drug and that drug and the outcomes. And that requires a lot of rigors and a lot of standards and
which we may not
we
be
need
able
to
to meet.
I think there may be one or two ongoing recently, but we certainly need more. And I think when we even get this research done in Africa, it's going to open the doorway for black people, black women all over the world, because even if you did it in the US and the majority of people are Caucasians, the data there on the black side will be very few. But if you come and you did it in Ghana or somewhere in Africa, everybody's so we'll get lots of data and we'll be able to see the trends and see. So for all you know, we may need to tweak things a little bit to get better outcomes for black women. Yeah, so we need to push for research.
But is it a thing that African countries are interested in? I mean, why are we still, again, with the way the world is moving forward, why are we still relying on... I mean, I know this is not a political or, socioeconomic conversation, but I mean, of course, it's a cause for concern. Why are we not funding these things for ourselves? And we rely so heavily on the West to do their research, and then how does that make you feel as a doctor? Perhaps a little helpless, maybe?
Research, especially clinical trials, you need a lot of funding. Yeah, so you need to be able to attract funding. And also you need, it goes through a very rigorous process. So you need to be able to meet certain criteria. But like you said, if we realize that's important and we focus there, we should be able to attract that. Yes, it does actually need some political will as well. But those of us in academia are also pushing along those lines to see if we can get that done. And I think definitely that is the way to go.
Okay, if you're just tuning in, I am speaking to Dr. Josephine Nsaful, and we're talking about breast cancer. We're also taking your questions. So 055-1111-997, 055-1111-997. This one says, I have some very visible veins at the left side, close to my armpits. Is that a cause for alarm?
No, usually breast cancer doesn't show up in the veins. I mean, when you have advanced breast cancer, the breast is huge, it's painful, you can have some, engorged veins over it. I mean, that's different from what she's saying.
Yeah, this just seems like hair dyes and breast cancer.
Good question. So, not only hair dyes, but also perming cream.
Okay.
Relaxes.
Okay.
So you go online and then today you see this, tomorrow you see that. So the evidence is not conclusive.
Okay.
So indeed I've seen stuff and read stuff that suggests strongly that relaxers can cause breast cancer, hair dyes. But then there's no, I just talked about rigors of research. There's no research or any work that has really shown a direct link. So for now, I'll just say that the evidence is not conclusive. Yes.
Okay.
I mean, if you're uncomfortable about it, then just stay away.
Don't. Okay. Kwame is asking about breast enhancement.
Whether breast enhancement might cause breast cancer.
Yeah.
So it doesn't. It doesn't. You can put in implants, you can reduce your breasts, you can get them bigger. It doesn't cause breast cancer. There is one type of implant that I'm aware of. I think that's the textured implant, but we don't even use them here. It's been known to cause a certain kind of lymphoma. It's very rare, and it's associated with a particular type of implant. So I think most plastic surgeons even don't use that.
Okay.
So other than that, no. Breast enhancement or breast cosmetic surgery doesn't. It's pretty safe, and we actually do cosmetic surgery as part of as part of breast cancer surgery. Yeah.
Okay. That's good. Okay. This one says, hi doc, good evening. Sometimes I have a sharp pain in my breast. What could be the problem? That's such
very wide.
Yeah, very.
I mean, the good news is most of the time pain in the breast is not cancer.
Okay.
Most of the time it's not cancer. And so usually I don't panic about breast pain.
Okay.
Just go get it checked out. Most people, a lot of women have breast pain. You just sort of have to live with it after you've checked it out, and it's nothing. So
sometimes it depends on the cycle. You know, sometimes before your period comes, your breasts feel heavy.
Yeah.
Sometimes they're tender. Sometimes
that's cyclical breast pain.
Yes,
a lot of women have
that,
and it's normal for them.
It's not okay. Right. Okay. This person says, "Hi, Nima. Please, good evening. Please take your time and read every part of this. My message. Yes, please." Hearing survivors tell their stories of having their 2 breasts removed is disheartening, and I feel for them. To this, I want to say to all men, let us rise up and take the fight of breast cancer issues up with our women, sisters, wives, and move heaven and earth, education and resource, to support and minimize this among our women. Upon all the science and technology and AI, still our specialists don't know the cause of breast cancer, and it's worrying. And this should tell everyone that breast cancer is more, spiritual than medical and physical. May God help us all. Francis from Accra. So Francis thinks that, Francis is going with the school of thought that it's
spiritual.
It's spiritual.
So there you have it.
Yeah.
It might take a bit of convincing to tell Francis otherwise.
Yeah.
But like I said, this is something we see every day. Everybody comes, and when you probe, they all have that spiritual aspect, and it didn't end well, and then they come.
I mean, the truth is, I think for humans, we like to understand things. Like, we like to have resolution. So when there's something that continually causes a state of, I don't know where it came from, I don't know what causes this, we would rather, say, because everything we don't understand is spiritual, so then we would rather say, okay, it's spiritual, so that it gives us that resolution that's okay, this is where it's coming from.
To find the underlying cause.
Exactly.
But it's interesting when you look at the incidence of breast cancer, it's so much higher in the developed countries, in America, for instance. But the deaths in Ghana, in lower middle income countries, is so much higher.
Yeah.
So there's this imbalance. They have so much cancer, and the death rate is very low.
Yeah.
And then we have half the cancer they have.
With higher
but we
death
have
rates.
60% of the world's mortality from breast cancer is in low middle income countries.
Wow.
But then when you look at the way they think in the developed countries, when there's a disease, they see it as a disease. I have to go to hospital and take my medication, do surgery, this, and then they get cured. You see, so they don't seem to think it's spiritual.
It's spiritual, yeah.
And then they go through the treatment and they get their cure.
Yeah.
You see, so I don't know. I beg to differ, Francis. Because we are here and we think it's spiritual and it's not working for us.
And then we're not getting the treatment that we need. Which brings me to something we were talking about, which is the herbal treatment. And I was telling you that year on year again, when we have survivors come and tell their stories, a lot of them will talk about the fact that they were diagnosed and then they did the herbal treatment and then it didn't work and then it got worse. So what's your take on the herbal route when it comes to cancers in general?
Yeah. So I in summary, I just say it doesn't work, and I'm only saying that because of what I have seen. Patient after patient, then they tell you that I use this, I use that, I use this, and not one have I seen that has worked. So I would definitely say no, and the medication and treatment we have is for early breast cancer.
Okay.
So if it could even be the other way around, you come and complete the cancer treatment early. When you are done, you can go and dabble in other things.
Exactly.
But rather, they go and then when they come, it's advanced. And at that stage, we really cannot
do anything.
Cure breast cancer. I mean, we would do something, but
it may not be as effective.
It will not be as effective, yeah. But having said that, there are some alternative treatments that I will use the term complementary.
Okay.
So, these things, and even some of this herbal treatment, when you go and look at it, it's nothing strange. The vegetables we said we should use for a healthy diet. Now you want to use that as medication, the antioxidants. So they mop up carcinogens, not cancer cells.
Okay.
So, and there are other benefits, Like I was saying, ginger, for instance, helps with nausea and vomiting, and chemotherapy causes nausea and vomiting. So some survivors have discovered, when I take this ginger, or I take this fruit, I take that, it helps me go through the chemo. It helps me recover better. And if you take lots of fruits and vegetables during chemo, it boosts up your immunity and all that. So there are various things that can be complementary, but you can't depend on them as treatment. So there may be some role here and there for some of them. So maybe we can't categorize all of them. But I haven't seen a treatment that works. And I think that's where the concern is.
The concern is. I mean, when you said that, what stood out to me was the fact that the cancer cells, like, they can't be managed. Like, they have to be killed. And plants and fruits and vegetables and herbs don't have the power or the ability to kill.
Exactly. You need to hit hard. You need something. Cancer is an aggressive disease. And you have one chance to get it. So you have to, all guns blazing. Yeah. Bring out all your arsenal and then.
Yeah. So definitely use the herbs and the fruits and the vegetables to strengthen the good cells that are left after you kill the bad cells.
Exactly.
But, giving the bad cells food is not gonna. So I think we've done that. This one says, is it true that deodorant sprays can also cause cancer?
Right. So once again, you check, and I think there are some deodorants which contain aluminium. The sprays, some benzyl of some sorts. So all these may have been linked to cancer in some way. But once again, the evidence is not conclusive. So there is some research which strongly suggests this, but it's not conclusive. So I can't say, don't use deodorant. But if you're uncomfortable with it, and some will make the effort to look for a deodorant that doesn't contain aluminium. So there are some deodorants you just have to read on and see what it contains. The benzyl, the one that contains the benzyl that's in the aerosols, in the sprays. I think have been linked to lung cancer, not breast cancer. But obviously you want to avoid any type of cancer. So if you are not comfortable, I would say just stay away. Yeah.
Stay away from deodorant.
for maybe the type that you are not comfortable with.
If the person is not comfortable with deodorants, then they have to stay away from deodorants. Then
that could be a big problem.
Yeah, that could be a big problem.
So there are some deodorants which don't have the aluminium, but I think that the evidence even against that
it's not
strong. So I would be happy to recommend deodorant. I use deodorant.
Okay. Stanley is asking, what role can men play in stopping breast cancer?
So they can play a very huge role. And I think the first one is giving good sound advice, because the men are the leaders in society, and the women listen to them. A lot of women depend on the men. If the man says go to hospital, they'll go. If the man says don't go,
they won't go.
Don't cut off your breast, don't take the chemo. So we need our men actually to be at the forefront of the awareness. Because if the head of the household, or the one taking the decisions, and a lot of times is the one footing the bills in certain communities. So if they have the knowledge and they can give good counsel and give good advice, then we are halfway there. Yeah. So not only about taking the technical decisions, but also then we also need them for the moral support. Just being there, just being the encouragement, walking through their wives, exercising with their wives, it makes a whole lot of difference. Even if the partner can't foot the bills, but he's just there. Just being there makes a whole lot of difference. We have countless stories of men who've left the women when they were diagnosed or halfway through, or threaten them, if you go through with this treatment, I'm leaving you. So that doesn't help. We've also had a few people who've come in and then they said that it's the husband who noticed the lump in the breast when they were doing whatever they were doing. So I think that's also
helpful. So in all the doing whatever you're doing, make it,
if you see something, say
beneficial.
something.
Yeah, like if you see something, say something.
Yeah.
There's also the fear that women have, especially when it comes to like the mastectomy, and the fear of, okay, so my husband is potentially going to lose one of his favorite body parts of mine. Is that going to introduce infidelity and things like that? So I mean, and of course this is in response to Stanley, and just men being aware of the fact that we women have the capacity to worry about the things that you think we are not worried about. Like, you've been diagnosed with cancer and you are worried, okay, if they cut off my breast, is my husband going to cheat on me? It's like, women, we do that, so I think that maybe also that assurance from the men that I'm with you through this journey, and there is reconstructive surgery. I mean, when I think about reconstructive surgery, I'm like, it's actually like a brand new lease of life. You cut off the boobs and all of that, you get a brand new pair of boobs, nice, firm, perky boobs. So maybe also removing the stigma of reconstructive surgery, which brings me to the question about reconstructive surgery and what's the feeling like when you introduce, okay, we've cut off your boobs, but there is, we can put them back together. How is that received?
Okay, most of the time we even do it as one surgery.
Okay, so as you are cutting off,
so I take it off, and then my plastic surgeon colleague steps in and then creates a new one. So you go to sleep, you wake up, and then you have a new
set of boobs.
And how women receive it also has a lot of I don't know if it's superstition or it's a new thing, so people are not sure. You see, somebody even asked whether some of these can cause cancer. So people are not sure. The information and the myths and the misconceptions are out there. So people are not quite sure that it's safe.
Okay.
So some people don't want to hear of it at all.
Okay.
When you mention it, some don't want to hear of it at all. Some too, the first thing they ask you, hey, how much is it? Because it's an additional procedure, but it's not done as a cosmetic surgery.
Okay.
So, I mean, it's a longer surgery. So, more anesthetic drugs, more things going. So it's not outrageously expensive. If you are using an implant, you would have to purchase the implant. So obviously that would be a bit more. So people are worried about it for health reasons. And a lot of it is just a misconception. And then what if they get a complication? I mean, I think people have heard about a few people having complications. I mean, you could have any surgery under the sun and have a complication. It's just that I think when you have reconstruction and you have a complication,
it feels like it wasn't a necessary surgery.
And then you've gone and it's
become a problem.
And for me, as a doctor, my concern would be if the complication is going to delay your breast cancer treatment.
Okay.
So if you had a wound infection, and you can get wound infection without reconstruction, just when you remove the breast alone, you could get a wound infection. So it may take time for the wound to heal, and it may delay chemo or radiation.
Okay.
So that would be a concern if you got a complication, for instance. So there are various people who take it with such joy, a new lease on life, a way out, because we have some people who just cannot stand the thought of a mastectomy, of them losing the breast. So they refuse your surgery outright. They say, I'll go with my breast.
Okay.
But when you offer them the reconstruction, now they are paying attention.
Yeah.
Say that again. And they are so interested. And because we've been doing reconstruction for the past few years, now you have so many more people ready to part with their breast. So it has actually made a lot of difference.
Yeah.
It really has helped a lot of women come back, build back their self-confidence, their self-image. Yeah. And then there are some cases that are done as a delayed procedure. So if you didn't have it the first time, and then a year or two later you want to have reconstruction, the plastic surgeons do that as well. So it's been very helpful in rehabilitating people physically and mentally. Physically and mentally. So people receive it differently. But I think as time goes on,
it's
catching up. Then one person does it, another person does it, and it's catching on. And I think definitely is something that should be encouraged.
Okay. Well, thank you for that. Phyllis says, hello, my Dr. Josephine Nsaful. You are part of my survival story. God continue to bless you for the good work.
Hello, Auntie Phyllis.
Nana Kwame is asking about X-rays and cancer.
Yep. So I think he's referring to the mammogram. So the mammogram is an X-ray, really.
Okay.
It's just that it's an X-ray specially designed for the breast. It will squeeze the breast in 2 directions and take the X-ray image. And indeed, we know that X-rays or excessive X-ray could increase your risk of getting breast cancer. So the research has been done again. So if a woman were to get mammograms done every year, as we say, from the age of 40, and they keep doing it, what is their risk of developing cancer from that? So I looked it up and it's 0.02.
Okay. So it's not high.
At all. It's not even 1%.
It's not even 1%. Yeah.
Yeah. But it's not zero.
Yeah.
It's not zero.
It's not zero.
Fair enough. So yes, it's a risk, but look at the risk. But the figures also show that because people have been doing mammograms, it has reduced their chance of dying from breast cancer by 20%.
Okay. Because you're catching it early if there's
exactly.
something. Okay.
So it's a risk-benefit
analysis.
Thing.
Okay.
So you reduce your chance of dying by 20%,
and then 0.02.
So yes, there is some risk, but what is the risk? I think that we have to look at it in that perspective. Yeah.
So if you do you need to do the mammogram regardless, or do you need to feel something to then do? So for example, I've done a feel of my boobs. I don't feel any lumps. I don't feel anything. There's no darkening or changing color of the nipple. There's none of that. But I'm over 40, so do I still need to get a mammogram every year?
Yes. So we have the screening mammogram and the diagnostic mammogram.
Okay.
So if we find anything wrong with your breast, we will ask you definitely go do a mammogram, and that will be a diagnostic mammogram.
Okay.
So the screening mammogram, there's nothing wrong with you. You've even had a clinical breast examination, or you've checked yourself. So ideally, from the age of 40, you should start.
Okay.
Not necessarily every single year, but I think at least by 2 years, you should do it. And the recommendations vary from country to country.
Okay.
Some countries will be every year, some every 2 years. I think even 3 years. And
especially if there's nothing showing.
Yes, so that's just purely for screening, and that is for average risk.
Okay.
Yeah. So assuming somebody
family history
exactly.
Okay, then
it might be in your family or something. You're not part of that.
Okay.
You're going to do yours every year.
Okay.
We're probably even going to throw in some scans and MRIs and a whole lot of other things.
Okay.
Yeah. So ideally, you should try and do it every couple of years.
Okay.
And that's what is used to diagnose stage 0, stage 1 cancer. That's what they are doing elsewhere, such that they pick it up
early and
before it becomes a lump.
Okay.
Because the mammogram can pick up a 2 millimeter cancer.
Okay.
But you can't feel a cancer till it's about 1 to 2 centimeters.
Okay. So that's picking it up really early.
Really early.
And then, of course, the treatment has a higher chance of working. So
much better.
Okay.
And for all you know, it will be pre-invasive, and you wouldn't even need chemotherapy. Okay. So the treatment might be simpler, might be cheaper, may have less side effects. So definitely, that's the way to go.
Okay. All right. Last message is from Ifia Akuma Amwakoba. She says, thanks, Big Sis, Dr. Josephine, for enlightening us this evening.
Ifia, hi.
Yeah, that felt personal. Thank you so much, Doc, for being here with us tonight. Thank you for answering our questions.
It's a pleasure.
It's always a pleasure to have you. Thank you to you for staying tuned in. It's Breast Cancer Awareness Month, so you'll definitely be hearing from us again. But from the team and I, very big thank you. Have a wonderful night. My name's Animwaa Anim-Addo once again. If you missed any part of this, you can pop onto Facebook and watch and rewatch, and just to have things clarified for yourself. But coming up next is the news at 8, and then Overdrive